Do you ever find yourself running to the restroom or feel like you might not get there in time? Do you ever leak urine with coughing, sneezing, laughing, bending? Well, you may have urinary incontinence. Millions of people have urinary incontinence, and it is treatable. No need to be embarrassed. I'm Denice Justus with Salina Regional Outpatient Physical Therapy.
Well, Denice, thank you so much for being on the show. We're going to be talking about urinary incontinence today. So first of all, what is it and who does it affect?
Well, urinary incontinence is basically the involuntary loss of urine. Okay. So it's, you're not trying to urinate or leak urine, but it happens. And so who can it happen to? Really anyone, but generally it can be anywhere from a child who's maybe ages between like 6 or 7 and older, or it can be men or women that can have the problem.
Well, let's talk about what you do as far as physical therapy for treatment for these.
Well, there's a lot of causes. It depends on what's going on, but usually with men, women, and children, you will have muscle weakness. The muscles in the bladder are weak, and so you have that uncontrollable or either urge to urinate or with activity when you're coughing, sneezing, laughing, bending, that kind of thing, you're leaking urine because of lack of control. And so it's usually a case of either stress incontinence from muscle weakness or urge incontinence with something's irritating that bladder. And so what we do to treat that is to educate them on ways that they can modify their fluids and maybe not drink as much, things that are caffeinated or acidic that will irritate the bladder, and or also teach them how to strengthen those muscles, and then also use those muscles when they're going to do activity, recruiting those muscles so that they can perform those activities without leaking as much. And biofeedback's one of the best ways we can do that with the men and women, so they have a visual feedback of what the muscles are doing. For the children, it's more of a nighttime alarm to connect to them so that as soon as they have a drop of urine, the alarm goes off and they go in and finish urinating and then reconnect that device and go back to bed.
I understand you have a free seminar coming up. Why don't you talk about that?
So it's called Bladder, What's the Matter? So kind of a catchy phrase because it's like, what's going on? Why do I have? People are so frustrated with this, and they shouldn't be embarrassed at all because it's so common. We see it all the time, and it is treatable. And so at the conference, we'll be going a little bit more in depth about things that they can do and give them some handouts and talk about some things and how physical therapy can help them. And that is December 3rd. It's a Tuesday, December 3rd, from 6 to 7 p.m. at Salina Regional Health Center's conference room number 7.
If you're ready to address your issues with incontinence, ask your doctor for a referral to Salina Regional Outpatient Physical Therapy Clinic.